Hello, guys. So my name is Kavna. I actually well now, and so my chosen technological innovation is the closed loop closed loop uh, medication management. So this technological innovation uses three prominent technologies, which is the computerized provider order entry, the barcode medication administration, and also the electronic health record. So closed loop management medication management is an electronic medication management system that combines automated and innovative systems to form a closed loop of medication administration and management and seamlessly document all the relevant information. Um, it is a paper-centric medication management workflow and it reduces variation, identifies and eliminates unnecessary steps, and also reduces errors among the care team members. It also provides a closed loop process and access to consistent and real-time patient clinical information at the point of care. It also is a mandatory requirement for the stage two of meaningful use. So this closed loop involves 9 steps, and the first step, as is seen here, is the uh, the assessment. With this is the assessment of the patient by the physician. So the physician basically sees the patient, uh, assesses them, and makes a diagnosis and documents the patient's clinical problem. The next step is the decision making of the provider. So the provider uses the clinical data entered into the electronic health record to make clinical decisions on the patient and also make recommendations about the patient. So the recommendations decisions made are used to uh, make are used to order medication for the patient using the computerized provider order entry. And this system enables healthcare providers to electronically enter, modify, and cancel orders in inpatient and ambulatory care settings. Uh, these orders range from medication, laboratory admission, procedure, and dietary orders. And the advantages of the computerized provider order entry. Um, Other entry is uh, to flag any like any allergies or contraindications that the patient might have, which helps to provide any to prevent any errors, and also it improves compliance with the hospital guidelines and policies, and also provides recommendations to the provider in terms of the diagnosis they came up with and the medication that needs to be ordered. The next step is review and verification of the medication by the pharmacist. So after the provider has put in the orders through the computerized provider order entry system, the pharmacist gets a notification which prompts them to verify and review the medication to make sure there are no basically any complications or any contraindications that prevents the patient from getting that medication. So the next step is the barcode medication administration. Basically, this is a system um, that especially labels and barcodes the medication before it's being dispensed to the units. So this barcoding system prevents medication errors, improves the quality and safety of medication administration, and also helps to generate online patient medical records. Uh, so the next step is the medication security. Basically, this is after the medication is dispensed by the pharmacy, it's stored and locked in an automated dispensing machine, which could be the Omnicell, which is what we use at my hospital, or like a medication cart that is found in the wilds, or any form of locked, secure medication, automated dispensing medication system, and we are waiting the nurse to administer the medication to the patient. So the next step after that is the assessment of the patient. So the patient is then assessed by the nurse to check for any contraindications, or let's say a patient is now showing different symptoms that might not make them that prevents them from getting the medication, such as probably um, high blood pressure or low blood pressure, preventing them from getting an antihypertensive or from getting a medication that probably increases their heart rate, vasopressor, or something like that. And then the next step is patient verification. So the nurse goes through the 6 rights of medication administration, which is the right patient, right dose, right medication, right documentation, right route, stuff like that. And after the nurse goes through these 6 rights of medication administration, they scan the patient's barcode, the patient's risk barcode, and the medication to make sure the patient is verified to receive that medication, and to make sure the patient receives the medication with all safety measures put in place. The next step is then that the nurse gives the medication to the patient and then documents the administration of the medication of the patient. This then sends real-time information to the providers and the pharmacists that the medication has been given, and then keeps the continuous loop and the continuous workflow collaboration between the nurse, the pharmacist, and the physicians and all that. So as I was talking, I kind of brushed over some of the benefits of using the closed loop medication system, and I would just go over some of it again, which is um, it measures the workflow of physicians and pharmacists and also nurses. It leads to a 23 to 56% reduction in medication errors and adverse drug events. It reduces cost and also saves time. It provides updated and real-time clinical information uh, to the providers and also nurses and pharmacists and all those involved in the care of the patient. Um, Hope you found this informative, and look to talk to you guys very soon. Thank you.